Welcome
All
back
right,
to the
man.
Runner Zone podcast. I'm Nathan Carlson. Chris, what's up, man? How's your Friday going?
Friday's good. Lulu almost escaped, and she must have a faulty homing device because she was out running around the neighborhood. But we got her in, and yeah, right now she's quiet. Hopefully, it stays that way.
Man, you need a little electric dog fence or something.
Yeah, well, we want to put a collar on her,
Oh yeah,
one that prevents her from barking and running outside. But I think my mom would have a heart attack. She's like an animal whisperer, and
oh
she
yeah,
tells me, yeah, she's like,
Good
that's
dog.
cheating. Yeah, she
Yeah,
said you should put that on yourself, and I said, well, I did. It
yeah.
wasn't too bad.
As long as you
So
test it on yourself first, I think it's fine.
yeah, so
So
that's my
today,
Friday, man. Yeah.
yeah, that's good. Yeah, and mine's good too. I'm ready for the weekend. Um, I mentioned this on social media. My favorite fiction book series is called Red Rising. It's a sci-fi series. It's on, and the sixth book just came out on Tuesday. So um, when I haven't been working, I've been reading that. It's like almost 700 pages long, but it's been really good. Um,
Yeah.
so I'm excited. I should be able to finish that over the weekend, and then a few more weeks and school start back. So back to
Yeah,
the
you're
swing of
like a
things.
speed reader, man.
Yeah, if it's good, I mean, I will say when I read, I'm much better at giving things up early now. To where,
Yeah.
if I get a book and I'm excited about it, or I get something from the library, or someone recommends something and I started it on, either I'm just not feeling it right then, or I just don't, it just doesn't work for me. I'm quick to just say, okay, I either am not going to read this, or I'm going to put it on my bookshelf and maybe I'll read it later. Um,
Yeah.
I think there's not much of a point in trying to push through that kind of stuff. Like it should be. I like to read for enjoyment. I like to learn too, but I mostly like to read because I think it helps me with everything else. So
Yeah. I'm right there with you, man. If I'm not feeling a book, that's it. Move on.
yeah, sure. So I've talked about this on social media a little bit in the past few weeks, and then I talked about this idea specifically in rehab on a couple infographics I've done recently. But today I thought it would be interesting to talk about kind of how you and I measure progress in the different domains that we end up living in. So how do we measure progress professionally? How do we maybe measure progress in rehab? And then what do we see when we talk to other clinicians or hear other approaches to things? Maybe talk about some of the pluses and minuses, and probably how it's changed, as we've done different things. So yeah.
Yeah. Where do we start with that question, man?
Well, I think it would be good maybe if we just started with when you were in PT school and you kind of cast out
Mhm.
onto your career. Uh, how would you have said you were going to measure? Maybe if you're were making progress in your career, or if you were being successful in your career, however you want to frame that. What would you have talked about when you were in school, or even as an early grad, as a young grad?
Yeah, I mean, I was very immersed in the research world because I somehow tricked Lynn Snyder Mackler into allowing me onto her research team. So I think that when I was going through graduate school, well, undergrad, because that's when it started, and then grad school, I knew I was very focused on trying to get publications. Whether
Mm-hmm.
I was, the lead author or just, a second, third author. I wanted to be involved, and I thought that the more publications I had, the better.
Yeah.
And I still think that that stuff is important. It doesn't. I put such value on the research, and I think that we have a responsibility as clinicians, coaches, to really stay on top of that. But I guess I feel like my calling is a little bit less about trying to publish papers and more about trying to share what I've come to learn and synthesize all of that information and package it to maybe teach other healthcare professionals, other coaches, and to really make sure that the people who need it most, patients and athletes, are getting that information. So I would say that's how things have changed a lot. I never anticipated sort of really niching down on running, though. I mean, I thought that I was going to basically fall in the footsteps of Todd Ellenbecker, because I dealt with a lot of shoulder issues from playing tennis. And, he
Mhm.
and I both have a keen interest in the sport. But over time, life started pulling me into endurance sports much more.
Yeah.
So how
Did
about you? I
those,
mean,
well, so one question first, as you
yeah.
kept going on, as you were at NISMAT, and then as you started your own business in New York, I would assume your approach changed. So how you would have described progress or success moving from working in that setting versus running your own business. I'm assuming that it would have been different then.
Yeah, and I mean Chris Johnson PT PLLC, for formality's sake.
Yeah.
That was born out of, in hindsight, really what my core values were. I actually just finished my newsletter for the month of July on this. And part of it is talking about just creating a very unique experience for people who are interested in working with me from a physical therapy standpoint. And I felt like I had sort of um, reached my plateau at NISMAT, and I wanted to continue to focus on patient care, because I feel like I wanted more reps under my belt. And yeah, I mean, money is important. You need to be solvent and get out of the red really fast, especially in a place like New York. Otherwise, you'll get gobbled up. But money was not the motivation to do that. It was to create just an unparalleled patient experience or journey for people who are going through a tough time, that I just knew there was a better way. And by focusing on that, the money was there, which comes as no surprise to you. But then it was sort of like, how do I maybe expand this? And I found out that that's not an easy thing to do, especially if you sort of are setting up an expert business, meaning like the business was named after me. Like, that's a tough
Mhm.
thing to grow. And I think you and I are both in that situation to an extent right now. People know us for who we are. It's not like we're trying to grow some monstrosity of a business. Um, so
Yeah.
that answer your question?
Which is not necessarily a bad thing. I was talking with an old professor of mine that we're working on a project together right now, and he was asking me. So he's not in Kansas City anymore. He helps run a PT program somewhere else in the U.S. now. But he was asking me questions about kind of running your own business, and because he has students that ask about that, or they're interested in that in school, and we talked for a while about kind of the difference between being just yourself versus a brand of a business. And
Mm-hmm.
there's obviously pluses and minuses to both of those things. One of the nice things about being just yourself is you get to determine exactly how things are communicated, how things are presented, and you can speak to a very specific audience. If you or myself had 5 employees, we had 3 PTs, we had a billing person, we had all these other things. If there was more, if you were responsible for more within your business than maybe just yourself and the service that you delivered, the you might not be able to speak to as specific of an audience, because you probably need more people outside of that coming in, which I think that's one of the things that people talk about. Again, it can be a good or a bad thing. But I appreciate that. And I was the same way. I learned really quickly, I don't want to manage people. I thought I wanted to do
Mm-hmm.
that first, but I just didn't want to do that. I wanted to do the thing I was going to do. And then if I had extra time, I wanted to do other things. Did that shift at all when you had kids? So you were, in New York, and
Did
this is my recollection. So correct me if I'm wrong. So in New York, no kids yet. Uh, you and
correct.
Mimi, yeah, at some point got married along in that lines, but then you all moved to Seattle, and that's where you had
Mm-hmm.
kids, right? They weren't born in New York; they were born in Washington, right?
Yeah, we got married in Seattle and then moved out here in 2013, and then Liv was born 2016. I better get these right, especially if Mimi's
Yeah,
listening.
I do the same thing,
Uh,
man. I'm like, my kids are
yeah.
this old and this old, and this was born in this year, and that was this year. Yeah,
Yeah. So yeah, that was 2016 when we started a family.
And
Um,
so, did that change? Like, even, people talk about having kids in different ways. That first couple of years, it's not like, I think the instant it happens, everything reorients itself. It's more of like a couple year process.
yeah.
So you had the first one, and then the second one came along. Did how you measure all this changed? How you were measuring your progress?
Yeah, I'm having to think about that. I think that my priorities just changed.
Hmm.
So, you know, how I'm going about measuring it. One thing I do, I was just talking to Mimi about this earlier, is that, I get an idea in my head and then I just commit to it. And I'm very persistent and I just basically keep checking Pomodoro boxes every day.
Hmm.
I need to get at least like my goal is to get 7 to 8 25-minute blocks of uninterrupted work where I'm emails closed, phones powered off, and I think that it just forced me to really, just tighten up my workflows. In terms of how I'm measuring progress, I usually am just trying to basically pick a couple big projects every year, some of the stuff you and I team up on. But I think that I'm focused much more on building a community. That's something that's really important to me. I suppose that's why, the runner zone is what it is.
Hmm.
Um, but I don't think that I'm doing anything different in terms of how I'm charting progress. I
Yeah.
think that that hasn't changed too much over the years. It's more my I've just gotten crystal clear on my core values, and yeah, I try and protect my time like there's no tomorrow.
Hmm.
Um, how do you go about measuring progress? I mean, I know you're always doing stuff on a whiteboard, and you try and get pretty granular with mapping things out.
Yeah, and I've always been like that. Um, even back to growing up as a kid, I always liked planning stuff out like that. Um, Now, I don't know if my wife listens to this podcast. My guess is she doesn't. But she would say I think that would sound like I'm really organized, and I'm not. So let me first be very clear that I'm more when I have ideas, it's more like, just give me the whole room and I'll figure something out. It's not the most organized
Yeah.
thing. But I've always kind of been like that. But I fell into the trap of what a lot of people do when you go to PT school, or probably any kind of allied health profession, and you're motivated, you care about it, you want to be really good at the thing you're learning, and you want success from that. And to me, early on, that was like, I want to work with professional runners, athletes and runners, make a certain amount of money. I'm going to get all these certifications. I want the stuff after my name, all those kind of things. And I do think it's really important to acknowledge that none of that is bad. But I
Mhm.
will say, as I've moved farther along in my career, what I care to think about or put my time to is definitely different than kind of the start. So I've talked about this in our business mastermind. I'm sure I've talked about it on the podcast before. Like, when I started my career, I mean, I had 30 years planned out, man. I don't have the document anymore. It's somewhere on, my laptop from college or something. But, it was, boom, I'm going to do this, and then I'm going to do this, and then I'm going to do this. And that was what a successful career was going to be. And then, I saw what the traditional path for a lot of PTs was, which was, if you worked in sports medicine, you would start as a staff PT, and then you would become a clinic manager. Maybe you would become a manager of a couple different places, a couple different clinics or something. And then maybe you would open up your own thing. But truthfully, when I started, I had no intention of ever opening up my own business. I was not interested in that at all. I just wanted to do PT. I didn't even coach or do strength training with people back then. It was just PT. And as I saw what that life looked like working for someone else, which, if anybody's worked in a sports med clinic, it's a lot of hours, it's a lot of patience, and it's exhausting. Like, it's very tiring. It's not, and it's a valuable learning experience, but it also is something where, you know, I saw other clinicians that were maybe ahead in their career from me. They're a little older, and we didn't have kids yet, but I saw them where they're like at the clinic at 8 p.m. They're going to Friday night football games at the local high school because that's what you do, because you need to market, you need to be seen out in the sports community, all those kind of things. And so there was a lot of time away from family, and even early on, before Ryan and I had kids, family was going to be a very important thing in our life, because that's how we were both raised in very loving, caring, supportive families, and so that was an important thing that we talked about even before we had kids. And I saw a disconnect between the typical career path that I had maybe aspired to and what I wanted life to look like. And that was kind of what started me on saying, maybe I have to do something a little bit different. Now, when I started my own business, I made all those mistakes again. So I might have my newsletter out before this goes up. I'm not quite sure, but a couple years into my own practice, it was the same thing. It's like, I'm working all the time. I have way too many things I'm trying to do. I'm waking up at 4 to get to the studio by 5 to see people, to then drive home to get what was just one then, get my son ready, to get him off to my in-laws, to then go back and, be there till 8 p.m. And so really up until about the pandemic, now you and I started working together a little bit before then, but really until about the pandemic, where I had to, everybody had to reorient themselves to a point. I was on the same track again, and it was just work all the time. Maybe, with that there's a lot of, you get a lot of praise because you work hard and you grind through things and all those things. It's all the same stuff we say about endurance athletes or business owners. And, I just got to that point where I'm like, I have to think about some things, and then figure out kind of what you're talking about when you're working on projects and other things. Like, how do I want to spend my time? I mean, one of the conversations I had with my dad before I opened up, because I'm going back and forth between, do I keep working for other people or do I start out on my own? He kind of highlighted the idea that, look, you're going to get to do this for about 30 years, whatever, you're going to be a PT for about 30 years, maybe. And then you'll be done. And so when you're thinking back on you as a, 65, 50, whatever, however old you are when you retire, you want to make sure that if there was things you wanted to do, that you did them if you can. Now, we all have different responsibilities and things. We all have different situations that we can't always just make decisions, maybe selfishly for ourselves. But that really stuck home with me. And I got to the point where I was still enjoying patient care and working with people, but definitely the progress that I was making on paper, because the resume was filling up, it wasn't correlating to like life feeling wonderful. And so that was when you and I started doing things. We started doing more mentorship with clinicians and really just maybe having more time for other things. And I would tell you, I look at things a lot differently now, where my wife and I have 2 kids. We got a house. I need to have a certain amount of money that's coming in for us to live our lifestyle. But the idea of always more, which was that's probably my default. Man, that just did not work in practice. And when I started to achieve some of the stuff that I set out on when I was probably in college, and I achieved some of those goals that I had thought would never happen, it was like they happened, and then you still had to go cut your grass. It wasn't this like life-changing momentous thing. It was more like just a little blip. And then, you're just, life's still the same. And then you kind of look back and be like, man, was the effort, the sacrifice, and all of that worth what I needed to do to get to that point? I was talking back and forth with a colleague of ours, Caitlin Sapp, about this idea on Instagram the other day, and about just, having like a lot of business success and then also seeing that and being exhausted. And we're talking, small successes, not massive things, but, I'm kind of like you now, where, I want to make sure that I, can help make a positive things and the professional things I care about. And now that's how we work with runners, more globally, that kind of the specific diagnosis of bone stress injuries, because there's a lot in there that I think we could do a lot better of. And I do care about maybe pushing that area forward quite a bit. And then how do you do this and, be present for your family and give to your community and all those kind of things, and trying to figure all that out. And so I want to make sure that the effort that I put into things, still in patient care, still in athlete management, because I like those things, but that isn't the only thing. And I think that if you can have a positive impact on other clinicians, other people that are out there trying to do the same things, I think that spreads a whole lot broader than if you're just trying to tackle the whole thing yourself.
Yeah, well, this makes me think of the book that you had recommended to me. We both read recently, called "The Second Mountain" by David Brooks,
Oh
and
yeah.
I think what we've done, and this isn't to pat ourselves on our back, but we've created a thick community, and it's people who, there's a code to become a part of this community about being supportive, upbeat. And, these are largely clinician coaches. And just knowing that, we're able to take a lot of our learnings, our mistakes, our successes, and sort of pass that on to younger generations of clinician coaches. And it's cool to see this, not only for them to embrace us, but to apply this and to help a lot of people, whether that's getting them out of trouble from a physical therapy or rehab standpoint, or if it's helping someone tackle a big hairy audacious goal like qualifying for Boston or Kona. And it's, it does sort of make you feel warm and fuzzy inside, much more than like, hey, we crushed and made $1 million.
Mm-hmm.
Like you said, that's great, but it hits in a less impressive way. So, and I'm all in favor of, we live in a capitalist society. I cheer all my friends on who are trying to, do these business endeavors. But,
Mm-hmm.
you know, yeah, I've realized through that book, as well as Arthur Brooks' book,
Mm-hmm.
From Strength to Strength, that, like, I really enjoy being a mentor to people,
Mm-hmm.
and that's where I am at this stage in life. So, um,
Yeah, it's very
yeah, I
different.
don't know
And
if
I
we're
think
getting
that,
off on tangents. So,
yeah, you're good. But I think that
yeah.
if that, for like the young aspiring clinician, coach, professional, all of those things, you hear that, oh, yeah, don't measure yourself by X, Y, and Z. But, it's like everybody says that until you're in it. And then, you kind of have to, I think you kind of have to get burned a little bit maybe to reorient yourself. And, I think that it's so easy to fall into those traps where that's what you're measuring yourself by, or like outcomes, patient outcomes,
Mm-hmm.
coaching outcomes. I personally I want to make sure that I am providing the best service that I know how to provide. So my experience, my understanding of the literature, everybody's unique situation, to try to provide the best thing I can for that person, even if that's not working with me, even if that's getting them to somebody else. And I think a lot of times it's focused on the performance or the patient outcomes, and not necessarily on, like, but yeah, but how are they, like, how's that person doing? How did it go? Did you really do the best that you can? I remember early on in my career, there was this like buzz that, reimbursement was going to be tied to patient outcomes. This was probably like
Mm-hmm.
2013, 14. And the expectation that if you got people better and less visits for a specific diagnosis, you were going to get paid more, or vice versa. We're not going to pay you if you don't get people better. And I think when we start to tie your reimbursement, definitely, but more like your professional growth, how you're doing, to the outcomes of your patients, that's tricky because outcomes are way out of sometimes the patient's control, even, but definitely out of your control. We had a clinician message and talking about kind of their experience where they were catching a lot of flack because they couldn't get somebody better. And if you're not watching the video, I'm putting quotes around getting someone better. And that's tricky because, again, like, pain is weird. Everybody's a little different. And there are people that get better in spite of what you do. And there are other people where you provide the best approach, the most supported by the literature, to their care, and they still don't improve. And so, when we're thinking about how are we measuring professional progress, again, it's easy to tie it to money, visits, all those things. It's also, tied to your patient outcomes, and that can be tricky because it's not super clean.
Yeah, I think it would be helpful to discuss that that particular therapist's message to you, because I think that's really frustrating when I hear if there's a manager or clinic owner who's hired a therapist and they're putting pressure on them or getting frustrated because, as you mentioned, that therapist didn't get the patient better. You know, I just think that's such an incredible teaching opportunity in a way for, all parties involved to come together and say, look, this is a really tricky situation.
Yeah.
We're glad that you're here and you're trusting your care to us. So, so-and-so, and as well as myself, we just wanted to, all sit down with you and say, how do we get this situation right? Or how do we improve your situation for the better?
Yeah.
So
And,
yeah, can you give a little bit more context to that?
Yeah, so this is a clinician that, they're newer in their career and at a clinic that prides themselves on being good, and is on the cash paced one-on-one model. So similar to what you and I do, and I know that is often portrayed as the best model. Like, that if you're doing that, then you're the best, and that's not for probably this episode to discuss. So this clinician had talked about their boss and how, they had made it very clear that, like, you need to get this better. It looks really bad on us if they go and see somebody else. And it sounded like it was a tough case. If they don't get better, they're going to go to somebody else. We're the best. You need to figure this out because, otherwise we're going to, this just looks really bad on our business. And, there's a bunch of different things with that. Again, first, like, you and I have connected with lots of patients that it is very apparent, like, we're not going to be the people to help you. Maybe we're just not a good fit personality wise, or, someone comes in and they need further testing that I can't provide. They need to see a doc, they need imaging, they need whatever it is. That stuff happens. And if we don't realize that we're not for everybody, I think that can be a really slippery slope for not getting people the help that they need. Now, you and I, and probably lots of people that are on their own shows, you want to make sure that people get better quickly. That's good for your business. That will do good things. And so it's not that having that expectation isn't a good thing, because maybe you're holding yourselves to a high standard, but there's lots of times where patients' outcomes are outside of their control and yours. There are things in their life that are much bigger factors than what you could apply or change in an hour-long session. There's times when, again, people need further testing that a physical therapist cannot provide. And there's times when surgical intervention is better than conservative care. We like to talk about how conservative care is the best thing for most injuries, and for most that should be what we start with, but it's not always the case. And so, when I hear that, I think that is really challenging because I just don't agree with that approach to patient care. I had a patient a couple weeks ago who you and I discussed. I really had no idea what was going on, and I definitely felt that I did not feel like I was going to be able to help them at this point, and so we needed more information. Um, and sometimes people reach out to me and they start with the insurance question, where they
Hmm.
say, do you take my insurance? And the short answer is no. And that it becomes very apparent that's the end of the conversation. And so you can go online and see all the scripts that you're told, okay, well, ask him this and do this and reframe
Hmm.
it, and lead with the conversation and then talk to them about price, like all these strategies that you hear online. But there's other times where like they should go to an in-network provider because that's what they want to do,
Hmm.
and that's okay. And
Hmm.
so I think you need to deflate your ego, and I have an ego too, just as bad at this, and get them to someone that can help them, or give them some names of some people to check into. And I think that if it's we solve all the problems, get it better, or this is just so bad for us, man, I just disagree completely with that approach to patient care, business development, any of that.
Yeah, it's uh, it's challenging when you're in a situation like that. I just can't imagine how stressful it would be as a new grad, because people are coming to pay you out of pocket. You're putting more pressure on yourself, which is going to basically take away from you just being present and sort of letting that session unfold organically. And you probably also don't necessarily have the expertise, or you haven't really identified a lot of these clinical practice patterns that you otherwise would have 5 years out. So I think that I've been reviewing a lot of the Therapeutic Alliance motivational interviewing research, and I think that what are people looking for? I mean, and again, this is generalization, but they want someone who's present, who's caring, that's empathetic, communicative, that's professional. It's like, make sure those things are at play. You know, if you're sitting there and, we stick with this guy's situation, you're like typing away on your computer and you're not really paying attention to the person, you're not anticipating their needs. Yeah, that would probably ruffle my feathers if I was a manager or owned the clinic. Um, but I think that you want this fellow to know, like, look, man, I have your back, and this is why you're here, and we're in a group setting. So if you feel like you're spinning your wheels with a patient, pull me over, and that
Mhm.
also is a sign of a consummate pro, someone who doesn't pretend to have all the answers, but who's willing to put their ego aside and reach out and say, hey, can I just pull you aside, and can I give you a lens into this patient's situation, and almost do it in real time, because the patient all of a sudden is like, wow, all this attention is focused on me.
Mhm.
Um, so hopefully that situation improves. I know I would handle it. I'm sure you would handle it much differently.
Yeah, and I think that it reminded me of a situation I had that ultimately was the thing that caused me to go out on my own, where I basically got into an argument in a clinic with my boss, who was mad because I didn't schedule someone out for their full script. I won't forget this. It was
Yeah.
a runner with knee pain, and we went through some things, and it seemed relatively minor. And so, I kind of left the end of that session similarly to how I do now, where it's like, these are the exercises. This is the stuff I'd be thinking about running wise. Why don't you just send me an email in a couple weeks and just let me know how you're doing? And if we need to do another session, we can, which is how I leave most of my sessions now, unless they're a stress fracture and we know that hey, it would be good to meet in 4 weeks or something like that. Um, and so I think that, that can be really challenging. So again, if we go back to like, how are you measuring progress? Your professional progress. I think that you can get in those situations and you can really quickly be like, I'm not going anywhere, man, because my outcomes aren't where they should be, or because you don't feel like you can provide the service you want to provide. Where you're like, for me, I need to be able to do X, Y, and Z to go home and feel like I gave it my best effort. And I think, again, that's challenging when, if your measuring stick for professional progress is outcomes, it's only revenue, it's only patient visits, it's all the things that are fine to track and not bad in and of themselves. But if that's the total picture, I think it can be really challenging. And, personally for me now, when I think about any kind of patient encounter, it's really just, I want to make sure I have enough time with the person. That's
Hmm.
really it. Like, I just want to make sure I have enough time to provide what I think I can so we can figure out the next step. But that's all I'm really looking for, whether that's 10 minutes or 3 hours. Um, that's all, because then I can go home and I can be like, I gave it my best effort. And that's what I'm trying to do in my career. And just like if it's like, I have to realize like this person is not improving. And so they should be with someone else, not Nathan.
Yeah. Yeah. Not rushing people through appointments. That's such a critical thing. And also with a lot of these patients that are consulting us, to really ask them. They're the experts on themselves. They know why they got in trouble, and to make sure that they have an accurate narrative around their situation. I was talking to a fellow yesterday that you and I have both consulted, um, where I had to get compact privileges to work with him, but I sensed that this guy really needed my help, and I also wanted to at some point get him in person with someone. And I'm like, look, you can come and see me, but it's going to be a much longer trip. I would say, like, go see Nathan. You can drive to him,
Yeah.
but this fellow, you cannot rush him through. I mean, there's a lot of moving parts, and he got pretty freaked out by a situation that he was dealing with his foot. So it just requires ongoing communication. But it was really important to help him get the narrative right. And he tripped off a foot issue, that ended up like being pretty irritable. And it was basically, and I told him, I said, look, man, you were a competitive tennis player in college, and then you had this hiatus where you really weren't getting after it for a decade. And he ended up playing pool volleyball for like 4 hours. So no jumping essentially for a decade. And then is like in a pool for four
Lots
hours.
of time. Yeah.
Yeah. And has a stiff great toe. And it's like, dude, you just really talk about committing a training error. But people don't always think about this stuff. They're like, I was just playing pool volleyball. I mean, that's a fairly innocuous thing,
Yeah.
but to really make sure, he just came to the realization that that's probably what kicked all this stuff into motion. And that way he has an accurate narrative that's going to allow us to help him move forward, and to just remind him things take time. That's one thing you and I know full well, dealing with bone stress injuries and lower limb tendinopathy, is this stuff does not clear overnight.
Hmm. No.
If someone worked with me and they're like, oh man, uh, I did a terrible job helping Chris with his knee. It was just going to be like a several month deal. I mean, it took me 16 months to overcome that patellar
Yeah.
tendinopathy.
Yeah.
So yeah, I think taking on the mentality that you're not there to get someone better, again in air quotes, you're there to troubleshoot with them, to
Mm.
find out what they think is going on, what they've done, what's helped, maybe what hasn't helped, what questions they have for us, what our thoughts and suggestions are in terms of how to best manage their situation. And I think that if you can, approach your clinical encounters in that spirit, that that's things are going to bode much better. And I think that you're going to be able to really help someone, just provide them with the reassurance and confidence in their body. Because that's the one thing I've learned, and I think that we take this stuff for granted, but when people go through injuries, they may be working under the assumption that, like, this is the way things are going to be for the rest of their life,
Yeah.
and it's like, again, this was the whole focus. I started writing this newsletter this month, brother, and it
Yeah.
turned into like a book chapter, because I'm
Yeah.
like, I have to speak to all this stuff, because, when you're trying to help someone regain trust and confidence in their body, it's not like you just manipulate them, or, you do some dry needling and carry on and they're all better. No,
That's good,
it's,
man. Yeah,
yeah.
I think, that is one of the benefits from my personal experience, to spending time in a training room. Um,
Hmm.
because one of the great things about that athletic trainers or a training room is, if you're working with an athlete, you might see them 5, 6 days a week.
Hmm.
Um, And so you have these constant check-ins. And I think so much of running injury management, especially when people are back to running, is taking some of the pressure out of the room as they're returning back to whatever 100% is for them.
Mm-hmm.
Because there normally is a lot of fear or anxiety with the situation where you're like, hey, my foot felt a little tight on my run today. How do I manage that? What do I do with it? In the team or the university setting, being able to come and talk to someone right there quickly is really, really beneficial. In the cash pay or just the models that we have where we can spend more time and have the opportunity to maybe communicate a little bit more, that can be really beneficial. A lot of runners don't have that opportunity. And so if they are, doing something on their own, they might be completely discharged from care, and they have to make a follow-up appointment with their physician in 4 weeks because that's when they can get in. And now they haven't done anything for a few weeks, and maybe the anxiety is worse. And as we've talked about lots of times, people run for lots of different reasons. Lots of people run for health and wellness, but there's a whole lot of other people that run because that's their community, because that's the way that they feel like they can balance their life. And so kind of a fundamental principle for me with any kind of patient is I want you running as much as possible, which is appropriate for whatever it is that you're dealing with. Because I think the more we pull you away, the harder it's going to be to come back, and the worse everything is in general for that individual. And so, yeah, I think that those narratives are really, really important to work through. And if we talk about how you're measuring professional progress, I want to continue to be better at working through that stuff, because I think that those are the things that I think are way more important. Like when I'm done with a patient, when we're, discharged, done with care, I really don't want them to see me again. I truthfully, believe that. I want you to run and do your thing and not have to come see healthcare providers. I want to see you at a race. I want to run into you in the community, but I want you to be able to do your thing, because that's the whole point of this whole thing that I do, is to keep you there, not here,
And you made a good point. I mean, in terms of like one of the advantages of being in a fee-for-service model is it just allows you to take your communication to a totally different level. So in a lot of times, hopping on a call for 5 minutes, rather than having some situation fester and just create more anxiety and distress, that's critical. I think of a woman who I'm helping right now who had a distal fibular fracture that was managed conservatively and then subsequently sprained her ankle. Otherwise, no issues on that side. And never did any PT. So, she's in completely rehab, but she's trying to make headway, and she's gotten pretty competitive with triathlon. But, as she started ramping up her running as well as her running intensity, she's getting a little bit of pushback from that ankle. And she's like, do you think anything's going on? And she has access to a physician's office. So, she got an x-ray, and I said, that's fine. But, I said, no, I don't think anything's going on. And let me remind you, that you just actually raced twice in the past 3 weeks, and you won your age group both times, and you're getting faster. So your ankle's just gotten a little bit sensitized. So, let's make sure that we're staggering your runs, back off maybe a little bit on the intensity, and let's just keep you training consistently. Just hearing that, changes a trajectory, because she's not sitting at work worried like, hey, do I need to get an MRI? Is this a bone stress injury? She just doesn't fit that script. But, I think a lot of people, if you don't have those communication lines with people, that I know myself, I worry. I think humans in general worry about things, especially if this isn't your field. I mean, you're going to really think we just default to thinking the most sinister thing is present.
Yeah, which most of the time isn't true. It's not to say that it can't happen sometimes, but most of the time it's not true. It's like most of the thoughts that people are thinking around this stuff is false. That's the that's the funny thing about it. Challenging for sure, but
I need to think about this question more. Like, how do we measure professional grow, or how do we do it individually? Um, yeah, and I need to go out on a long bike ride this afternoon, and maybe I should have done this before the podcast, but it's a tricky question. I think a lot of people don't take the time to ask that, and I suppose that I think that for me, when I feel like I'm whittling things down, I feel like for the
Mhm.
past several years I've been adding more, and now I'm like I'm trying to really whittle things down to say, like, what are the truths here, and what works, and then where am I getting signal, like if I take a certain approach.
Mhm.
So
I think that, yeah, I would agree. I feel the same way. I feel like I'm trying to do less things better.
yeah.
And so making sure that I can continue to make those things um, higher quality and have a positive impact on a broader range of people. I think those are some big things for me. I also think that it can be very easy to only focus on this around the world of work when,
Yeah.
just like when we talk with patients, there's a whole ecosystem around someone. And so for myself, I also want to make sure that I can run a successful business in the way that I define that, but also coach my kids' sports teams and spend
Hmm.
time with my wife and exercise, 6 days a week, and have some enjoyment that's not related to work. And for me, that enjoyment outside of work thing. That's one of my biggest challenges. Where if I'm measuring progress in that area, that one's slower, for
Hmm.
me probably than any other ones, because that's almost always the thing that gets left behind
Yeah.
when things get busy. And for some people, that's another bucket, right? That's family, that's exercise, that's whatever it is. Where you talk to a lot of business owners, and they're like, business is growing, but I feel like garbage because
Hmm.
I work 15 hours a day. And so I think trying to figure out how everybody measures their professional progress, that's a tough journey for all of us. If there's anybody listening that would like to share them, I had lots of people send me messages. Please send me an email. I'd love to read it. So I think that's probably a never ending journey, right? Like, you're not going to get to wherever that is, but I think it's the same thing with other things in life too. And some people do a better job of that than others. Um, with a lot of the people that you and I connect with, I think that so much of the focus ends up being on the professional side. It can be easy for us to maybe forget about these other areas.
Yeah. And I think that whether you're an athlete, whether you're an entrepreneur, you know, whatever the case, it's like broadening your identity, you know.
Mm-hmm.
So I was talking about Pomodoro blocks earlier. It's like, yeah, I mean, it's great to sort of be like, oh, I did 8 Pomodoro blocks today for work. Well, how many did I put in the family bucket? How many did I
Yeah.
put in, just, hey, my own, reading for enjoyment? Um, so I think it's like looking at these different buckets and making sure that you're trying to fill them up somewhat equally. Um,
Yeah.
and I'm all in favor of, obsession, like where
Yeah.
you
Me
really
too.
want to focus on something, but I think also make sure that you, pull your head out of your computer and look up and just pay attention to the other moving parts in life. That's a
Yeah.
challenge. I mean, especially with like runners and triathletes in particular, because, now they have 3 separate sports that they're trying to get better at. And they're trying to basically, you know, just fire on all cylinders across all domains of life. And something's got to give, you
Yeah.
know?
Really
So,
tough. Really
yeah.
tough. Yeah, and I think this is probably one of our more meandering podcasts,
Yeah.
but my hope is that people can maybe think about the silly stuff that we say, and that can help them. Because I think that the first step, and I think trying to figure out all this stuff, is just making it aware that you should, like, because I got the same response when I posted on social media, like, how do you measure professional progress? I got a lot of responses that are like, dude, I have no idea. Never thought of that.
Yeah.
I probably should think about that more, and I'm
Yeah.
the same way, right? Like, I ask these questions to other people because I'm asking them myself. Um, and yeah, I will say I one piece of progress that I made. I mentioned the book that I got this week. I knew this book was going to come out on Tuesday, and so Wednesday. This is the first time I've ever done this in my career. I took the whole day off work on Wednesday, and all I did was read. I met our friend Becca for coffee because we have a once monthly coffee meeting. But I read the rest of the day, and I rode my bike in my basement.
Great.
That was it, and that was very challenging to do. You know, which it probably shouldn't be. You know.
Well, I think that that's sort of the mindset that gets us in trouble. It's like it's a double-edged sword. It's like, you can focus so like almost to a fault, but you and I also both know that, your ideas and your productivity are much better when you get this balance right, where it's not like you just hustle and grind and you put in, 12-hour days. I used to, when I was transitioning to my own practice, I was involved with another practice, and the practice administrator, that was her mentality, is that you just grind and, there's no complaining. No, I'm like, this is never going to last. I'm like, I need to get out and do my own thing because I want to, go to work and then middle of the day, go ride my bike for 2 hours, come back, work a little bit more, maybe, do something in the evening for enjoyment. But yeah, it's always like you're going to get left behind or you're going to have to play catch up. And that's a very toxic mentality.
Yeah. Yeah. We'll see. So you'll go out for your bike ride, and then you'll have a very descriptive answer of how you measure progress on our next episode. You'll figure it all out. I got a good feeling about this bike ride.
Yeah, well, Fridays riding around Seattle are always dicey. Everyone's in a rush going nowhere, and the fancier the car, the more reckless the driver. Like I tell people, I'm like, just stay on your trainer on Friday afternoon, because we live a little bit further north. These days, the roads are generally good, but yeah, I mean, if you even think about triathlon, I mean, I think people love these sports because it is easy to measure progress, but after a while, it's like, okay, you've gotten faster. Great. You've gotten another Ironman under your belt. Maybe you've hit the podium again. Great. What next?
Yeah.
So, and I think this is why it tends to really, I mean, I think it gets a lot of people out of trouble and gets them focused. But I think by the same token, it also, I've seen the sport wreck a lot of, relationships, marriages, businesses, so on and so forth, so.
Yeah. It's always, hard work and grinding. And again, numbers and revenue and all those things are not necessarily bad, but they, I think you should think about them. I try to do a better job of thinking about them in maybe a broader context than I used to. Where's the best place to ride around Seattle? What's the best route? If you could eliminate traffic, where would you go? There was gone. Just
if I could eliminate traffic,
where would you go?
I would say really there's so much good riding around here. So I like riding around Tiger Mountain, Cougar Mountain for people who are familiar, Snohomish Valley. I mean, it's just, you can get whatever terrain you want. I haven't explored Mount Rainier. They have a ride around Mount Rainier one day. It's called Ramrod. It's like 158 miles. I would love to go down and do that. I'm sure it's spectacular this time of the year. But there's also great mountain biking. Yeah. But just where I am in my neighborhood, it's awesome. I can go out and within 2 hours climb about 4,000 feet, which is generally what I default to. But I just love being out on my bike anymore. Everyone's always like, "Hey, what race you do?" I'm like, I just love training. Maybe I'll race if it makes sense. But I also think this is something that I had to be very careful with because, with the family nowadays, I can't be selfish to the point where I'm like, "Hey, see you, hon. I'm going to go out and ride my bike for 6 hours. You have the kids, right?" Yeah. And I still feel like I have a lot of potential in the sport, and I want to tap it. I want to actualize it. But I think right now it's a little bit more of a yellow light time, and I
Yeah.
think that just having the maturity and, just better decision making to realize that the world's not about me right now. And,
Yeah.
and I think as the kids get older, where they want nothing to do with us, then maybe I'll plug back in, and that'll be a good time away from racing. And I've still been racing, just not as frequently.
Yeah.
Um,
Yeah. I think about that too,
so
that my kids still like me. And so I don't want training to impact my ability to be there for them. Because I
yeah,
know as they get older, they're not going to want to spend as much time with me. And I think, if you're parenting, you're also creating independence, so they don't need you for everything. Whereas when they're little, they
yeah,
need you for everything.
yeah,
And so I think about that all the time when I measure professional progress, where it's like, if I were to measure, and I would be farther along, whatever that means, today than I am right now, and that was at the cost of less time with my kids, or like them feeling that dad just worked all the time, I would not be okay with that. I want them to I want them to see that I care about what I do and I put my best effort into it, but I don't want them to think that that's all that dad cares about.
yeah. And I think to be very cognizant of the language they're using, and because sometimes, because I work at home and I'm in the garage, the
Mm-hmm.
kids will come, when they get back from school, they'll come through the garage. So they'll see me working, and they'll
Yeah.
sometimes Kyle will be like, "Oh, Dad, you're always working. Let's go skateboard." So if I start hearing that a little bit more frequently,
Yeah.
I'm like, there's the whisper,
Yeah. I gotta
let's
go
not let it
skateboard.
turn into a scream. Yeah,
Yep.
it's time to go
Yeah,
skateboard.
absolutely.
Yeah.
What do you still skateboard?
Yeah, man. And they just put a new skate park right down the road, and I have to get the kids' helmet and all the pads, just so I don't want to deal with a trip to the emergency room. But
Yeah.
I would love to just be down there skating a couple times a week, just not doing anything crazy. I can still do some
Yeah.
flip tricks and ride around a bowl and do stuff like that. But the fact, because growing up in Pittsburgh, this stuff was not accessible. If I grew up in Seattle, I would probably be a Red Bull athlete, just because
Oh
of
yeah.
all of the parks, the water, the mountains, just what they do in all these neighborhoods. So yeah, next time you're out, we'll go skating.
Oh man, I cannot skate at all. So that will
Yeah, I
be
have a longboard for you. You
I
can
would
just
not
cruise.
I just don't want to break my radius or my clavicle or
Yeah,
anything else. Yeah.
yeah,
Well, cool. Well, this is a good episode. I hope people found it helpful. Yeah.
yeah. Like you said, a meandering episode, but
Meandering.
I
That's
think
okay.
I think that hopefully people find some of the stuff that we discussed resonates with them. And
Yeah.
as we always remind folks, we're still on this journey.
Yeah. Yeah. Well, that's the whole point of this, right? Like the whole point of any of the social media, email list, podcasts. Like for me, it's just sharing information. I'm just trying to figure stuff out, and if I find something interesting, I'm happy to share it.
Cool. All right, man. Well, enjoy the rest of Red Rising, and I hope you and your family have a relaxing weekend.
Thanks, man. You too.
Take care.